Hello everyone, this is the first lecture of General Anatomy and the chapter which I am starting is Introduction to Skeletal System. I preferred the book BD Chaurasia. You can prefer any other book which you want. In my college basically we used to study from this books only as it was suggested by the professors. So the skeletal system is basically divided into two skeletal systems, that is axial skeletal system and appendicular skeletal system. Axial skeleton consists of three parts: skull, vertebral column and thoracic cage. So the skull consists of cranium, facial bones, ear ossicles and hyoid bone. Cranium has in total 8 bones in it, and facial bones, that is the bones of our face, has 14 in number, and ear ossicles, which are 3 on each sides, has 6 total bones, and hyoid bone is one single bone present in our bone. Cranium consists of 8 bones, that is frontal, parietal, temporal, occipital, sphenoid and ethmoid. Frontal bone is 1 in number, parietal 2, temporal 2, occipital 1, sphenoid 1 and ethmoid 1. So here we will learn the concept of some words, which is superior, inferior, unilateral, bilateral and anterior, posterior, which will help us to understand where the bone is exactly located. So if I have this, so this is our skull and this is the part of your cranium. Here is where cranium is actually located. So this is your frontal bone, which is 1 in number, this region, and this is your parietal bone, here, this region, parietal bone. Parietal bone, if you see, is bilateral present, that is one on this side left side and one on right side, whereas frontal is one single bone and it's therefore known as unilateral bone. Frontal 1, parietal 2, bilateral, one side left side and right side. Now the second one is temporal bone. Temporal bone is this side. This will be your temporal. So frontal, parietal, temporal. So occipital will be in this side, occipital bone, which is on the posterior side. This is your anterior region, this is your posterior region, this is superior, this is inferior. So here we learn around 6 words, which is anterior, posterior, superior, inferior and unilateral and bilateral. So the another bone is sphenoid and ethmoid bone. So if you see here clearly, there is this butterfly shaped bone. I hope it is visible to you all. It is sphenoid bone. It is a butterfly shaped bone and it is a single bone. And this is your ethmoid bone. Ethmoid and sphenoid. So total cranium has 8 bones. Now another part of our skull is facial bones. We have covered the cranium, now facial bones. Facial bones has 14 bones in number. It has lacrimal bones. Lacrimal is present on the medial side of the eye. Now there is another catch. What is medial and what is lateral? So if you see the skull, the part which divides our body into halves, that is, you can consider an imaginary line. The location, the bone or exact joint, nerve or anything that is present towards the middle line, that is called as medial, and the one which is away from that line is called as lateral. So this is your medial region, this would be, and this would be your lateral region. Okay, so lacrimal bones are the 2 bones present on the medial side of the eye, that is this bone, and another bone is nasal bones, that is 2 in number. This would be your this bone, this side, nasal bones, and the one which is present on the septum of your nose, that is vomer nose. Vomer, lacrimal bone, nasal bone and vomer. Zygomatic bones, which is 2 in number again, and this is this side. It is also known as cheekbone. Also I forgot to mention that lacrimal bone is the smallest bone of skull and zygomatic bone is also known as cheekbone. Now we have maxilla, which is 2 in number. This is your maxilla, 2 in number, and now we have palatine bone, which is here towards the inner side of your maxilla. This is your maxilla and inner side is your palatine bone. Now it is mandible. We do not have mandible here. So mandible is 1 in number. It is all your lower jaw. This is maxilla, this will be your mandible. And inferior nasal conchae, it is 2 in number. It is on the inner side of the nasal bone. So in part of skull we have covered cranium, facial bones, and now there is ear ossicles and hyoid bone. Ear ossicles is 6 in number, which is 3 on each side. Ear ossicles has 3 bones. These are the smallest, tiniest bones: malleus, incus and stapes. And the other one is hyoid bone. It is a U-shaped floating bone present here, and the floating bone means it does not articulate with any other bone. So in axial skeleton we have completed skull, and now we are left with vertebral column and thoracic cage. So in vertebral column we have 26 bones. In newborn it is actually 33, but it fuses and now it forms only 26 bones. So it is in our back, and it started with cervical and ends with coccyx. Cervical, we have 7 cervical bones in this side, and now when we move down it is consists of thoracic, which is of 12 bones. Now lumbar, which is 5 bones, and sacral 5 bones, and coccyx 1. Initially it is used to be 4 in newborn, and now it fuses in adults to form one single bone, that is coccyx. Now cervical C7, which we usually donate it as C7, T12, L5, S5 and C1. C1 is also known as atlas, that is the first cervical vertebrae, and C2 is also known as atlas, which is the second cervical vertebrae. Now here are two concepts: intervertebral disc, that is it is a fibrocartilaginous pad that is present between the two vertebrae. So this is our sacrum bone here. This is the anterior view, and this is the posterior view. In the anterior view it is S1, S2, S3, S4 and S5. It is this region of hole is known as sacral foramen, and on the posterior side it is sacral canal. And here you can see the coccyx. It is also known as tailbone. Here I have one of the rib, thoracic vertebral rib, and this is your anterior region and this is your posterior region. This region is known as spinous process, and this is your transverse process. It serves as an attachment point. The spinous process is for primary muscles attachment, and this is for the deep muscles and rotator muscles for the attachment. I have covered skull, vertebral column, and now it is thoracic cage. So the thoracic cage consists of 2 parts, that is your sternum and 12 pair of ribs. Sternum is also known as breastbone. Here it is present. You can see it's sternum. So the sternum consists of 3 parts, that is this part is known as manubrium, body and the xiphoid process here. So in sternum, this is for the attachment of your collarbone. You can see here it is present sternum, and here it is the attachment of your collarbone on both sides. And here we have our ribs attached, 12 pairs of ribs present. So sternum is a T-shaped bone, also known as breastbone. It is 1 in number. We have 12 pair of ribs, where the first to 7th rib is also known as true ribs. It is known as true ribs because it is attached to sternum, that is here is their attachment. And 7th to 10th ribs is also known as false ribs. It is attached to your 7th bone. 11th and 12th bones are known as floating ribs because they have no attachment, and therefore it has more chances of fracture. So here we are at the end of our lecture. Now we will revise whatever we have learned in this lecture, that is axial skeleton. So in axial skeleton, first we have learned that it is divided into 3 parts: skull, vertebral column and thoracic cage. Skull, vertebral column, thoracic cage. Now skull is anotherly divided into cranium, facial bone, ear ossicles, hyoid bone. Cranium 8 bones, facial 14, ear ossicle 6, hyoid 1 single bone. Cranium is now again divided into frontal, parietal, occipital, temporal, sphenoid, ethmoid. Parietal and temporal is 2, that is bilaterally present, and others are unilaterally present. Facial bones: lacrimal, nasal bones, vomer, zygomatic, maxilla, palatine, mandible, inferior nasal conchae. Where vomer is a single bone and mandible is, that is your lower jaw, is single. Rest all are 2 in number. Ear ossicles, Melis incusens caves, 3 on each side, total 6. Hyoid bone, single bone. Here it completes our skull part. Now vertebral column. Vertebral column is cervical, thoracic, lumbar, sacrum and coccyx. 26 in number. Now thoracic cage is divided into sternum and 12 pair of ribs, where sternum is again divided into manubrium, body and xiphoid process. We will study sternum in detail in another incoming lectures. 12 pair of ribs, true ribs, false ribs and floating ribs. Ribs also we will study in detail. For now, in general anatomy, only this much is included that is necessary for you. Thank you so much.